I would like to tackle the issue of how artificial intelligence can actually change public health education. As we know, COVID-19, among other things, has taught the world how important education and research really are. And there has been some tremendous progress made in this area, including new discoveries. And these are the use of technology, innovation at every field, modern teaching philosophy, and above all, of course, the use of artificial intelligence. And this domain has opened new avenues. The way in which countries have worked together to address the pandemic threat, coordinate emergency plans, evaluate the effectiveness of their actions, have proven that these processes are the largest initiative of global solidarity and alliance in human history. Many of the models we have used are related to artificial intelligence and saved us from thousands of working hours and time that presently we do not have. I usually say to our students that time is the most precious commodity they have in their lives right now. So because of the pandemic, it is obvious that the education sector was greatly affected. Approximately 1.6 billion students from more than 190 countries, that means 91% of world students' population, experience interruption in the educational process. However, not only we responded effectively, but we came out stronger. So we embraced the challenges in the most productive way when we need it most. So within a few days, the educational community had to take traditional teaching to another dimension, that of the web. So we had to improvise, innovate, and become global. What was expected to happen in years or decades, it happened immediately. The world has become a global education hub, an international learning village. This change was cataclysmic, and the role of artificial intelligence more than crucial. So the domain of public health was not an exception. It is expected that the future of education, not in a few years anymore, but literally tomorrow, will eliminate the traditional class, the borders between countries and all that stereotypes for acquiring knowledge. Technology can turn our whole lives into learning experiences. Some scholars argued 100 years ago that higher education seemed on the verge of a technological revolution. The spread of a powerful new communication network, the modern postal system in the past, enabled institutions to distribute the courses beyond the boundaries of their campuses. So anyone with a mailbox would enroll in a class. That was many, many years ago. But today, this little historical reference seems incredibly distant. We now have, all of us, artificial intelligence in our hands, academic chatbots, virtual tutors, and machine learning. All this under what we call Internet of Things. A few years ago, Facebook CEOs and founder Mark Zuckerberg announced the creation of a new 3D world in the metaverse environment, as he called it, borrowing the Greek word meta. For all of us who have been through many years in distance education and had an experience with AI when it looked like science fiction, it was an expected development. 5G, the use of Web 3.0 tools, modern and asynchronous distance learning models, virtual rooms and selves, what we call avatars, and also smart books and multimedia had already been integrated into our public health education models. This created a whole new world for public health education. Today, however, we have the opportunity to ensure that the integration of emerging technologies in every aspect are fully accelerated, and that distance and digital learning becomes an integral part of any public health educational program. This in turn will lead to a more holistic, comprehensive, and creative pedagogical solutions for health professionals. Distance and digital education not only kept the traditional educational structures active during the pandemic, but also made the learning process more open and accessible than ever. So in this perspective, health courses are now global, and the student community is made up of different nationalities and backgrounds. Education today has literally abolished international borders and rediscovered itself as a global commodity, as I mentioned. And this commodity is accessible to all 24 hours a day, regardless of geographical or other restrictions. It is more than certain that in the near future, all the latest innovative technological developments in artificial intelligence and modern educational methodologies such as open learning, social media, learning through devices, smart devices, mixed learning, augmented reality, and artificial intelligence will be fully utilized in public health education. Modern education is indeed a commodity that brings a new stream of positive thinking about diversity and continuing learning. So I have a phrase here from Alvin Toffler that once said that the illiterates of the 21st century will not be those who cannot read and write, but those who cannot learn, learn again, and of course, relearn. So today, public health educators must be able to do the following four things: recognize and achieve goals and aspirations in response to global challenges, enhance their knowledge with a global perspective, recognize that they belong to an international community, practice their skills and creativity beyond their close environment. And how they achieve this? In that context, what we need in modern public health education is a new teaching model that achieves the following changes in learning dynamics: from teacher-centered to student-centered learning, from the transmission of knowledge to the building of knowledge, from passive and competitive learning to active and collaborative learning. So now we are talking about what I call the artificial intelligence knowledge economy that needs to be developed so to absorb the growing talent pool. So in this framework, all the big companies and organizations have been very active in the new educational environment that is being built. Microsoft has AltSpace, Facebook has just released Horizon, and Victory XR has created the world's largest academic campus on the Engage platform. So we can now easily imagine that enormous potential that a student will have on a digital and virtual hospital campus, for example, or using virtual labs to accompany their theoretical lectures. They will also be able to travel back in time and also into the future. So the virtual digital health campus will, of course, not be intended to replace the physical one, but to complement it. So the day is not far when the artificial intelligence robotic teacher will see through diagnostic processes the real needs of a student, and in this context will propose and execute an individualized study and learning plan. So it is important to remember that the individual student becomes the center of the educational process. The legacy of what global education with the help of AI has achieved during the pandemic, but also during the last decade, is in fact that it has literally created an educational revolution. The new innovative and modern teaching methodologies that were adopted led to a better knowledge of the world around us and helped us to deal with it better. So more than ever, global developments dictate the reorientation of existing educational structures and the creation of new ones, so to meet the new challenges that health students are facing. As education continues to shift from the national to the international environment, countries and health organizations have strong incentives to develop the skills of their populations through training initiatives. So we could never have a better ally and companion than artificial intelligence for embarking to this trip. So thank you very much.